I am living with a blood cancer called lymphoma.
You got this.
My care team and I tried treating it previously, but unfortunately the cancer didn't respond to the treatment. I spoke to my primary oncologist, and they recommended a CAR T-cell therapy called Breyanzi. My husband and I discussed this further, and we decided this would be the best option for me. This treatment is powered by my own cells from my own immune system to find and fight my lymphoma. Recently, I met with a CAR T specialist at the treatment center for an initial consultation to be sure I met the eligibility criteria to receive Breyanzi. I was glad to learn that I did. My doctor recommended that I receive Breyanzi in an outpatient setting, but also pointed out that some people may need to stay in the hospital after treatment. They explained the process to my husband and me, and we discussed the benefits and the risks of Breyanzi. They gave us the opportunity to ask questions, so I feel prepared and informed on what to expect. Today, I'm back at the treatment center with my husband for the next step in the CAR T-cell therapy process. Before I left this morning, I made sure I had everything to keep me comfortable throughout the day.
Now I'm going to take your blood pressure.
After being called back, the nurse checks my vitals and escorts me to the exam room where I meet my care team.
As we discussed, we're starting with a process called apheresis, or leukapheresis. This medical procedure involves collecting your blood and separating the T cells, a type of white blood cell, from the other blood components. The remaining blood is infused back in your body, and the T cells will be sent to a lab to be reprogrammed into your CAR T cells.
When we're done, my T cells will be sent off to the manufacturing lab. My doctor explains the role of this process during my procedure.
I'd like to show you a short video that will explain a little bit more detail. The highly skilled technicians at the manufacturing facility take the T cells that have been collected and add the chimeric antigen receptors, or CARs, to these T cells to become CAR T treatment. This is then infused back into your body to help fight the lymphoma. You're in good hands.
Now that I'm settled in, the nurse verifies my identification to ensure my product has my information for accurate tracking throughout the process. I am now ready for the nurse to begin.
Because this takes a few hours, we'll be with you the whole procedure if you need anything. Let me know right away if you feel any discomfort. I will see you in a little bit. Let me know if you need anything. Apheresis is complete, so we'll see you in the next few weeks for the next step in your CAR T-cell therapy process.
Several weeks later, while my CAR T cells are being manufactured, I am back for my next appointment. As discussed with my doctor, to prepare me for the Breyanzi infusion, I need 3 days of low-dose chemotherapy leading up to receiving my modified CAR T cells.
We call it lymphodepleting chemotherapy. It helps prepare your body to receive Breyanzi.
After hearing the doctor explain this part of the process, I am one step closer to receiving my Breyanzi infusion. When my CAR T product is ready, I head back to the treatment center for my scheduled infusion appointment. My husband worked with a cell therapy 360 patient support navigator to locate a place for us to stay nearby, so we don't have to travel far today or for the next several weeks while I'm being monitored. To begin, my nurses verify my identity and confirm my Breyanzi cells, and then give me acetaminophen and an antihistamine before my Breyanzi treatment to minimize any infusion reactions.
Today's the day to get your Breyanzi infusion. You're going to be receiving 2 different cell types given one after the other. These CAR T cells are intended to expand and travel throughout your body to detect and fight the lymphoma.
Next, my care team uses an IV tube that they place into my vein and saline to flush all the IV tubing at different steps throughout the process. It's now time to administer my Breyanzi. The infusion process is going by fast, and I only need to do it once. Less than a half hour later, the infusion is complete.
You're done.
The doctor again explains that side effects may happen within the first few weeks. The nurse explains the importance of keeping up with long-term monitoring too, and recommends I coordinate with my primary oncologist to schedule regular blood work, as well as to check for any other side effects or secondary malignancies.
So we'll be checking on you daily for the first week, and we'll closely monitor for side effects for 4 weeks following your infusion, but you may require additional monitoring at the hospital. Some people experience symptoms such as fever, chills, or difficulty breathing due to cytokine release syndrome. And people may also experience headaches, dizziness, or confusion due to neurologic toxicities. But our team here is prepared to manage these side effects if they occur. So give us a call immediately if you experience any of these. Okay? All right.
Thank you.
I'll take it from here.
So after this initial monitoring, your care team will schedule regular blood tests to continue to track your progress and to check for any lifelong secondary malignancy. If you feel any unusual symptoms or you have to miss an appointment, it's important that you contact us immediately. All right?
Yes, I finished it.
Leaving the treatment center, I am hopeful, knowing that my body is one step closer to potentially achieving remission. Talk to your doctor to see if Breyanzi may be right for you.
Indications. Breyanzi is a prescription medicine used to treat a type of non-Hodgkin lymphoma, large B-cell lymphoma, when your first treatment has not worked or your cancer returned within a year of your first treatment, or your first treatment has not worked or your cancer returned after the first treatment and you are not eligible for hematopoietic stem cell transplantation because of medical conditions or age, or 2 or more kinds of treatment have not worked or stopped working. Breyanzi is different than other cancer medicines because it is made from your own white blood cells, which have been genetically modified to recognize and attack your lymphoma cells. Important safety information. What is the most important information I should know about Breyanzi? Breyanzi may cause side effects that are life-threatening and can lead to death. Call your healthcare provider or get emergency help right away if you get any of the following: difficulty breathing, fever, 100.4 degrees Fahrenheit, 38 degrees Celsius or higher, chills, shaking chills, confusion, severe nausea, vomiting, diarrhea, fast or irregular heartbeat, dizziness, lightheadedness, severe fatigue or weakness. It is important that you tell your healthcare providers that you have received Breyanzi and to show them your Breyanzi patient wallet card. Your healthcare provider may give you other medicines to treat your side effects. Before getting Breyanzi, tell your healthcare provider about all your medical problems, including if you have or have had neurologic problems, such as seizures, stroke, or memory loss, lung or breathing problems, heart problems, liver problems, kidney problems, a recent or active infection. Tell your healthcare provider about all the medications you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. How will I receive Breyanzi? Breyanzi is made from your own white blood cells, so your blood will be collected by a process called leukapheresis. It takes about 3 to 4 weeks from the time your cells are received at the manufacturing site and are available to be shipped back to your healthcare provider, but the time may vary. Before you get Breyanzi, you will get 3 days of chemotherapy to prepare your body. When your Breyanzi is ready, your healthcare provider will give it to you through a catheter placed into your vein, intravenous infusion. Breyanzi is given as infusions of 2 different cell types. You will receive infusions of one cell type, immediately followed by the other cell type. The time for infusion will vary, but will usually be less than 15 minutes for each of the 2 cell types. During the first week after infusion, you will be monitored daily by the facility where you received your treatment. You should plan to stay within 2 hours of the location where you received your treatment for at least 4 weeks after getting Breyanzi. Your healthcare provider will check to see that your treatment is working and help you with any side effects that may occur. You may be hospitalized for side effects. Your healthcare provider will discharge you if your side effects are under control and it is safe for you to leave the hospital. Your healthcare provider will want to do blood tests to follow your progress. It is important that you do have your blood tested. If you miss an appointment, call your healthcare provider as soon as possible to reschedule. What should I avoid after receiving Breyanzi? Do not drive, operate heavy machinery, or do other activities that could be dangerous if you are not mentally alert for at least 8 weeks after you get Breyanzi. This is because the treatment can cause temporary memory and coordination problems, including sleepiness, confusion, dizziness, and seizures. Do not donate blood, organs, tissues, or cells for transplantation. What are the possible or reasonably likely side effects of Breyanzi? The most common side effects of Breyanzi are fatigue, difficulty breathing, fever, 100.4 degrees Fahrenheit, 38 degrees Celsius or higher, chills, shaking chills, confusion, difficulty speaking or slurred speech, severe nausea, vomiting, diarrhea, headache, dizziness, lightheadedness, fast or irregular heartbeat, swelling, low blood pressure, muscle pain. Breyanzi can increase the risk of life-threatening infections that may lead to death. Tell your healthcare provider right away if you develop fever, chills, or any signs or symptoms of an infection. Breyanzi can lower 1 or more types of your blood cells: red blood cells, white blood cells, or platelets. After treatment, your healthcare provider will test your blood to check for this. Tell your healthcare provider right away if you get a fever, are feeling tired, or have bruising or bleeding. Breyanzi may increase your risk of getting cancers, including certain types of blood cancers. Your healthcare provider should monitor you for this. Having Breyanzi in your blood may cause a false positive HIV test result by some commercial tests. These are not all the possible side effects of Breyanzi. Call your doctor for medical advice about side effects. For more information, go to Breyanzi.com or call 1-888-805-4555. You may report side effects to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see full prescribing information, including boxed warnings and medication guide.